In England, we will remove all remaining domestic restrictions.
A lot of us are leading much more normal lives, perhaps most normal now for the last couple of years during the pandemic. But the latest results from the Office for National Statistics show COVID really hasn't gone away. In the week up to March the 12th, 3.25 million people across the UK had the disease. That's about 4.8% of the population, and it is an upward trend. That's the concern for many people. If you look at what's happening since the Omicron peaked in the beginning of January, when about 6.8% of the population had the disease, since then cases have been coming down to about 3.8% at the end of February. But since then, they've been going up. There are many different reasons. You can look at the lifting of Plan B at the end of January. You can look at the Prime Minister's statement that we would be living with COVID in future. And that has led to a big change in behaviour. People are more relaxed. The wearing of face masks, the use of lateral flows, social distancing, all these things have been decreasing in recent weeks, and people are mixing more with others, both socially and at work. And that, of course, gives an opportunity for the virus to spread.
There will be new variants, and it is very possible that those will be worse than Omicron.
The big difference is that we're now dealing with a slightly different virus. For the first few months of this year, Omicron has been dominant. It's now called BA.1. But that's now being overtaken by a very similar virus called BA.2. The two of them are so similar that they're called sister variants or subvariants, and they are both just as sensitive to the vaccine. They both cause the same very mild disease. But the point is that BA.2 is 1.4 times more infectious, and that gives it the edge over the original Omicron virus and allows it to spread much more quickly.
There are sort of so-called subvariants of Omicron, and we're not concerned about any of those at this important time.
There has been some talk of this Deltacron variant. It's a hybrid, if you like, of two different viruses, the original Delta and Omicron, that have come together, probably in one person who's been infected with both viruses at the same time. That has been an issue in France, but the Health Secretary, Sajid Javid, has said there have only been a handful of cases here in the UK. And at the moment, there's no clear evidence that it's any more of a threat than Omicron itself. And of course, Delta was effectively dealt with by the vaccine. The situation in Hong Kong is certainly a concern, but it's very different to what we're dealing with here in the UK. In Hong Kong, vaccination rates of the elderly are much lower. It's only about 1 in 3 people over the age of 80 have actually had the vaccine. So the most vulnerable are still unprotected against the virus which is spreading around there.
Hong Kong, disappointingly, no problem with vaccine supply for well over a year, had not achieved coverage of our most vulnerable group.
The second point is that in Hong Kong, they use the Chinese Sinovac vaccine, and there has been a great deal of concern about just how good that is. And the Chinese are understood to be looking at mRNA vaccines, developing their own, because those have really stood out in this pandemic as the best way of protecting people against the rapidly evolving virus.
We need to find our own way out of this epidemic. It has outgrown our capacity.
It's unlikely that here in the UK we would suddenly be developing a situation, the dreadful situation they're encountering in Hong Kong, where some say that they're actually beginning to run out of coffins because deaths are so high. Hospital admissions in the UK are also rising, and many people are concerned about that. The rise in hospital admissions aligns very precisely with the rise in cases. Both started to take off at the end of February. Now, in previous waves, you would have had a lag between people getting infected and people getting so ill that they needed emergency treatment. This time that hasn't happened. They're both happening at the same time. And that suggests the rise in hospital admissions is actually due to people coming into hospital with the virus, but are being treated for other conditions. They're not coming in for treatment for COVID itself. It's an important distinction. So although hospitals will be disrupted by the rise in emissions, it doesn't mean that we're going backwards and that as a nation we're suffering more severe disease. Quite firmly, the answer is no. This is a very different situation. The vaccine is still highly effective, the immunity is being topped up as the virus spreads, and the two together are in a very effective way of controlling the spread of the virus. It's very likely that as the weather warms up and we spend more time outside, that too will have an effect on transmission. But that doesn't mean Omicron has gone away. It may well return in the autumn as the effect of the boosters does begin to wear off.
The most important thing you can do is get your booster.
We've already heard that the government is planning some kind of booster campaign in the autumn months just to make sure that we are topped up and that we can go into the winter, hopefully, better prepared than we have been in recent years.